Welcome back. October is Breast Cancer Awareness Month, and all this week, NBC 26 will be featuring stories related to the detection, treatment, and the fight against that disease. Tonight, we're focusing on genetic testing and how this has become a life-saving option.
The thing that raises the red flag is it's 3 generations.
As Kate Hackett-Bear goes over her family history.
Take back the fear of, doing the monthly self-exam. Take it back.
She feels proud of her journey. Diagnosed at 32 years old with stage 4 breast cancer. Immediately after her diagnosis, she met with Bobby McGivern, a genetic counselor at Theta Care's Cancer Center.
Some people have a lot of information with specific dates and reports on cancers, and some people have very little.
McGivern says they see 2 groups, those already diagnosed with cancer, like Kate, and others with a strong family history. Patients initially come in and talk about their risks, and then a blood or saliva test is done, targeting specific gene mutations. Results take a few weeks.
People sometimes have a misconception that it is like a crystal ball, and it's going to be able to tell you, okay, you won't get cancer, or yes, you will, and here's when it will happen. And it's nothing like that. It really is a risk assessment.
From there, counselors help people develop an action plan, things like being screened early. Testing can range from several hundred to several $1,000s, but most is not out of pocket.
A lot of insurance companies have realized that it's going to be cheaper for them to pay for preventative tests than to pay for cancer treatments.
For Kate, although her testing was not used for prevention, she used it for treatment, a plan specifically for her.
I was kind of angry. I was kind of angry that I was the youngest and the first to be tested when so many people had experienced breast cancer in my family.
Now she's spreading the message: genetic testing can save lives.
I think I've had 18 cousins that have let me know that they have been tested.
She doesn't want people to be afraid. Instead, use it as another option.
I'm just so glad that people are taking the information and doing something with it
to fight breast cancer and end the disease.
Now, genetic counselors want to remind everyone this is not a definitive answer. They cannot tell you if you will get cancer or when it will happen, but they can help you develop that plan of action to detect cancer as early as possible.